Hello and welcome to Wellness Wednesday. I'm James Currie with the Communication Department. I'm talking to Dr. Deborah Walks. She's a pediatrician here with Family Health. How are you, Dr. Walks?
I'm doing great. How are you, James?
I'm never better. Thanks for being
Great.
on Wellness Wednesday. It's kind of an important subject. You're a pediatrician, which means you see children. That's what a pediatrician does.
That's
But
right.
the problem during this pandemic is you're here, but the children aren't. So,
Right.
we don't know why. There is a reason why. I mean, it's all over. It's all over the nation. The American Academy of Pediatrics says that there is a decline in well child visits and just overall pediatric visits going to see your doctor. So, tell me why. Tell me why that is.
Well, you're right. I mean, general wellness visits for children are down since the pandemic. You know, right now is a time that we really want to have health and wellness, particularly now during the pandemic. And the way that we assure that in children is that they come in for their wellness visits. There's many of them that occur under 2 years of age. We have frequent well visits for children under 2 years of age, and then once they turn two, we do them annually, once a year. But we've seen those visits drop tremendously, and I have to assume that it's fear of the COVID virus, catching the COVID virus
Mhm.
while they're at clinic. I can completely understand that fear. This has been a difficult thing for all of us to go through. I just want to reassure our patients that we are doing everything in our ability to keep our clinic as safe as possible. For example, we're checking the temperature still of all of our employees as they come in the door. All of us, from the clerk at the front desk to the person that takes your temperature, the person that does your lab work, the nurses, as well as the providers, the physicians and nurse practitioners, we're all masking up. Um, we're doing as best we can with social distancing in the waiting rooms. In the exam rooms, I often glove up when I'm doing a patient exam. We all practice good hand hygiene. We're washing our hands a lot. And then we're doing a great deal to keep the exam rooms themselves clean as possible. So, during one of the reasons that probably one of the biggest reasons we want children to come in for their wellness visits is because we give immunizations during the wellness exams. Immunizations are probably my best tool in my toolbox to keep children healthy. And we've noticed that the immunizations rates have gone down during the pandemic. We want to protect the children, particularly the youngest, under two, especially under 6 months of
Mhm.
age, from, I think I counted up the 13 diseases that we're immunizing for at these early visits. We don't want to see, breakouts of things like whooping cough and measles, which can happen when you don't boost the immunity of as many individuals as possible. When in a community, when the immunity goes down, for measles, it's about 90%. When it goes under that, you can have measles outbreaks, and we don't want that to happen in our
Mhm.
community.
Right.
So, again, those are reasons to come in to see the doctor for the child's wellness visit.
Yeah, we love children. You're in pediatrics because you love children. So, we don't want them to come in the door just simply because we miss them. There's a science behind it, obviously. There's percentiles, there's certain benchmarks that they have to reach in their normal development. So, you know, in order to back the science and the medicine behind that, they need to be able to come in to see the pediatrician so you can get their height and their weight and their overall health to see are they along the lines of where they need to be developmentally because they're growing. I mean, this is you're supposed to see the dentist twice a year. That's every 6 months, and you have a certain schedule too also for development up to 5. It's the same with WIC. They have to come in at certain times. So, it's yes, we miss them and we like them, we like their children, but there's also a reason why we want them to come in too.
Well, I'm glad you brought that up because I do miss seeing my patients. That's the
Mhm.
special thing about being in primary care, and particularly in pediatrics, is you develop relationships with the families, you develop relationships with the children, and it's wonderful when they come in and you get to see them again. But you're right. I mean, kids grow rapidly, particularly in the first 2 years of life. The brain grows to about 75% of its full size in the first 2 years of life. And so our job, my job, is to make sure that the children are growing and developing well. Um, a trained pediatric eye can pick up subtle developmental abnormalities that even the primary caretaker, the mom, the dad, might not see.
Mhm.
And if they're picked up early, many times we can get therapies and treatment and give advice that will eventually make this not a problem, these developmental delays. If they're not picked up, these developmental delays can cause problems throughout a child's life. And so it's extremely important for them to come in for us to pick up these subtle abnormalities. Now, another thing that we do, obviously, in our wellness visits is not only take a thorough history, but we also do a thorough physical exam. We lay hands on the patient. We listen to their hearts with our stethoscope. A heart murmur might be picked up. A skin rash, a subtle little lesion on the or mark on the skin um, might be a sign of something going on in an organ in the body. So there's things that we can pick up. As you said, are they growing well? A child's main job is to grow. And so we plot those on curves. And so these are all things that we do, at the wellness checkup. We check hearing once they turn 3, we begin to check vision and then hearing on children. If children have these abnormalities in their sensory organs, a vision problem, a hearing problem, these can cause real issues down the road. So we want to pick them up early. Another thing that we do, James, is we do a lot of screening lab work. Um, when a baby is, 2 to 4 weeks old, when they come in to see us, we do what's called a metabolic screen, which is just we prick the heel of the baby and we are checking for approximately 50 different diseases, metabolic diseases, in that one laboratory test. Um, as they grow, as they develop, we do more screening labs. The first couple of years, we're checking for anemia, which is actually quite common. It can cause a lot of problems
Mhm.
with the growth of the brain and the development. We're also checking for lead poisoning in the first couple of years of life. As children grow and get older, we do several cholesterol checks to see if there's any issues with cholesterol. And then we're also checking for various infectious diseases. And obviously, if we pick up abnormalities in or issues or problems that we're concerned about in the wellness checkup, we can do further lab work. So there's just a lot of things that we check on these wellness visits that we're missing by not coming in. So please, please, not just because I miss your children, which I do very much, but please come in so we can make sure that your kids are growing and developing well.
That's right. You touched on herd immunity just a moment ago. You've got your button on. I've got my button on too. We've been
Right.
vaccinated because we're trying to build up herd immunity. That's been talked about a lot lately in the news. Dr. Randy Murphy here, our epidemiologist, has spoken about us trying to get vaccinated to get herd immunity up. Dr. Scott Chavers, our other epidemiologist, has spoken about it. You just
Mhm.
spoke about it, and all of these childhood vaccinations, these are all for the greater good of us in society to build up that herd immunity so that when these diseases do appear, they're not as severe as they used to be, or they're contained. Helps your body fight off all types of let's just simplify a lot of bad stuff. So um, but yeah, you want to get people to come in for obviously a well child visit. but there are some other types of visits I know that you can do and you have done. You've done some telehealth visits for different types of visits. So, I mean, um, you're very accommodating for, just overall child health.
Well, we hope to be. Yes, we want to make it as accommodating as possible. I wanted to touch on something, James, that you were talking about a minute ago about herd immunity.
Mhm.
I think we as a society have become quite complacent about many of these diseases that we're immunizing against. And what that means is that our immunizations have done such a good job that we actually don't see a lot of the diseases that we immunize against. We don't see diphtheria very often. We don't often see pertussis, tetanus, mumps, rubella. I could go on and on. And so sometimes we become complacent and think, I don't really see these diseases in my children or my friends, so I don't really need to get immunized. But as you're saying, if too many people take that stance, then we don't come in to get our children immunized, and the immunity in the community drops,
Mhm.
and we can then begin again to see these diseases, which some of them, particularly in our young children under 2 and under 6 months, even more so, if they get these diseases, they can be deadly, or they can, have permanent effects. So again, we just want to really emphasize coming in for those wellness checkups and those immunizations. But yes, we try to be as accommodating as possible. We cannot do wellness visits for the reasons I alluded to earlier. We touch the patient, we check things on the body. We can't do wellness visits on telehealth, but there are things that we can do on telehealth exams. We can, talk about a sore throat. We can talk about runny noses or eye problems or behavioral problems even. Um, but it doesn't replace the wellness checkup. Also, one thing about the wellness checkup that I didn't mention is, we do all these things to check growth, to check development, to check hearing and vision. But we can also do other issues. We can talk about evaluate and treat problems during the wellness checkup. So we're
Mhm.
not just doing, growth and development. We can treat strep throat. We can treat a bladder infection during the wellness visit, and we actually do those things. There's so many things that we cover in a wellness visit. I haven't even talked about car safety.
Mhm.
Social. As the child gets older, we go through social and emotional issues, which as a child gets older, as they go through those teenage years, parents need to be supported because it can be hard to deal with some of the things that come up in prepubertal and pubertal children. So we are there. The pediatric provider is there to be a support to the caretaker of these children, to tell you that we care about you and we will do everything in our possible ability to help you navigate through not only the early years, but as children go through middle school and their high school years, to support you and help you, excuse me, through these,
Mhm.
through these times. So,
Um, I was going to give your appointment line number for people to
okay.
make an appointment with you. So that would be 251-690-8889. And
Hmm.
that's also going to be posted with the notes and information for this video. Um, Thank you so much for your time. Been very, um, we weren't all comprehensive about everything you do and everything that you can do. I think we hit the cliff notes. There was some good
Hmm.
bullet points of things there. Hopefully, parents will feel comfortable enough knowing that we've been vaccinated for, COVID here. We're taking safety measures. We're taking temperatures. Things are cleaned and sanitized. We have very good support staff, janitorial, keeping everything clean, and it's very safe to be able to come back to the doctor. And that's one of the things that should not be neglected right now during a pandemic is don't neglect all these regular things that you need to do, and that is getting your child in to see the dentist, see the pediatrician, and you touched a little bit about the whole social aspect of it. And, if we're not careful, uh, children, we're raising a whole generation of children that may be fearful of going to see the doctor now.
Well, that's true. That is another aspect. And nobody loves a child like a mom or a dad, right? So, because of that love that you have for that child, you want them to have the best life possible. And so there's, again, we've talked about this morning, but there's so much growth and development that's going on those early years.
Mhm.
Um, we want them to have the best life possible. And so that involves bringing them in and letting us help you raise a healthy, happy child. The best way to do that is let them come see the doctor, the pediatric provider, let them come see the dentist. We are keeping our clinics as safe as possible. And we look forward to seeing you. I've missed seeing all my patients. So please come in and see us and help us help you raise a happy, healthy child.
Good message. Dr. Walks, always a pleasure. Thank you for being on Wellness Wednesday.
Oh, you're welcome. Great to see you this morning, James. Thank you.
Yes, ma'am.